Welcome to Michigan Family Medicine Advocacy Day training. We're so excited to have you join us for Family Medicine Advocacy Day this year. Let's review some basic advocacy best practices and examples of how to effectively advocate for issues that impact family medicine. Research the legislator with whom you're going to meet, even if you're just meeting with staff. What political party are they from? What issues do they care about, and what votes or positions have they taken? What committees do they sit on? Typically, our issues fall under the jurisdiction of the Senate and House Health Policy Committees. Familiarize yourself with their district. Research their next election. Who is their opponent, and what are their re-election prospects? Educate yourself on the issues and priorities that are expected to be discussed during your meeting. And finally, review the briefing materials and documents prior to your meeting. These materials will be provided to you in advance of Advocacy Day. Reflect on and practice your story. Reflect on your own positions on legislative issues. For example, do you support the Affordable Care Act, or is your position more nuanced? Think about the reasons why you want to become, or you are, a practicing family physician. Identify your passions, or the issues you feel most comfortable speaking on if the opportunity arises. Here are some best practices to note. First, be professional. Dress code is business casual, or white coats if you prefer. Be punctual. It's typically best to arrive no more than 5 to 10 minutes early, and of course to not be late. Be flexible. A legislator's schedule is always changing, so be prepared to wait or be moved to another time or location for the meeting. Be warm and friendly to staff. There's always a chance you'll meet with staff instead of the legislator, and that's okay. Staff can be very influential, particularly in our term-limited environment, so establishing relationships with them can be just as important as the legislator. Be accessible for follow-up. Bring your business card or your contact information in another format to leave with the legislator or the staff. Consistent follow-up and communication is key to effective advocacy. Now we'd like to share some advice that will help you be prepared just prior to the visit. First, get together and get organized with your assigned group. Make sure you know who your group members are. A group leader or spokesperson will be designated. Ensure that each participant understands his or her role during the meeting to mitigate the risk of one person or one issue dominating the discussion. And finally, recognize that some individuals may be more comfortable speaking out than others, or more confident discussing one topic over another. Discuss with your group what the priorities are and what issues you plan to address. Remember that you're speaking on behalf of 2 organizations representing thousands of family physicians in Michigan. Topics covered during the meeting may be highly dependent on the legislator or the staff. Finally, it's important to be prepared to talk knowledgeably about at least 2 to 3 issues. Now some tips to help you during the visit. First, introduce yourself. Clearly state your name and where you work or where you attend school. Indicate what town you're from in the legislator's district, or if you care for patients in his or her district. The following video demonstrates how MAFP President-elect Tina Tanner opens her meetings with her legislator.
Good morning, Representative.
Good morning. Welcome.
I'm Dr. Tina Tanner. I am a practicing family physician, and today I'm here representing the Michigan Academy of Family Physicians as their president-elect.
Wonderful. So you see patients in my district then?
Yes, I do. My office is in Hesperia, Michigan. It is a rural health center. We receive both federal and state funding to help take care of our patients.
Excellent. Well, we're so glad that you're here today.
And we appreciate your time as well.
Remember that you are educating them. Be prepared for questions. Legislators and staff must stay on top of countless issues and may not be well informed about yours. If you're discussing specific legislation, don't assume they know anything about it. It's important that at least one person in the group knows the background of a bill. Be clear and consistent with your message. There should be a consistent overarching theme when you're discussing the issues. For example, inform the legislator that family physicians do so much more than diagnose the common cold. They treat the whole individual and the whole population from infants to geriatric patients. Thus, in order to meet increasing demand for access to quality health care, we need to grow the primary care workforce. Allow the conversation to flow naturally. It's important that major points are addressed to the extent possible, but there's no need to force it. Time can run out without you being able to cover all of our priorities. That is, of course, what the leave-behinds are for. Commit to follow-up. Let the legislator or staffer know you'll be in touch in the future regarding the issues you discussed. The following video demonstrates how MAFP President-elect Tina Tanner educates her legislator on Senate Bill 2, Senator Mark Jansen's Advanced Practice Registered Nurse Scope of Practice Bill.
Representative, one of the bills that we would really like to discuss with you today is Senate Bill 2, the Advanced Practice Nurse Scope of Practice Bill. It did pass in the Senate last fall, and it is now before your committee, Health Policy Committee. Michigan Academy of Family Physicians feels that we really need to work on this bill, that in its current state, we as family physicians really cannot support it. Nurse practitioners are a wonderful part of our healthcare team, but that's where we need them. We need them to be a part of a patient-centered medical home, providing a team practice approach, rather than separating them and fragmenting the healthcare system more through an independent scope of practice. We feel very strongly that this could harm the healthcare in Michigan and be very difficult for the citizens of Michigan to understand the differences.
My concern is that I live in a rural area and access to healthcare is an issue for my constituents. And I feel, or what I've been told, is that nurse practitioners are more liable to go into those areas than other primary care providers.
I know that that is something that the nurses are promoting, but as a family physician who has practiced my entire time in rural areas and as a person who lives in a rural area for the past 10 years in your constituency, I do understand the need for healthcare providers in those areas. But in any state that has done this, they have not shown an influx of nurse practitioners into rural areas. The same economic difficulties that keep physicians from going to those areas do stop the nurse practitioners from going there as well. So I don't think that this is actually a valid solution to getting more providers into those areas. And if they're working independently outside of a patient care team, in rural areas we have extremely complicated patients that are often very sick when they come in. They really need the expertise of a physician or a physician-led team. I'm afraid that if we separate nurses out in an independent scope of practice and they don't have that connectivity with a family physician, that the healthcare in rural areas such as ours will suffer.
Well, I really appreciate you bringing those concerns to my attention, and I will certainly keep in touch with the chairwoman of the committee, and we will see if the committee considers it this year. I will reach out to you. Now some tips to ensure successful conclusion of your visit. First, make sure a designated person presents the leave-behind materials. A business card from our staff will be included. Second, extend an invitation to your practice. Invite the legislator and staff members to visit your office or discuss future opportunities to meet in the district. Commit to follow-up. Let the legislator or staffer know you will be in touch in the future regarding the issues you discussed. The following video demonstrates how MAFP President-elect Tina Tanner concludes her meeting with her legislator.
Representative, this is my card. It does have my personal cell phone number, and I invite you to use that to contact me with any questions you have on any healthcare-related legislation, and in particular on Senate Bill 2. I also would like to offer the hospitality of my office. We would be more than thrilled to host you and show you what we do on a daily basis.
Wonderful. I would love to come out and see what you do on the ground. That would be an excellent opportunity.
Wonderful. If there's some time in your schedule, please contact me. I'm sure we can arrange that.
Great. Well, thank you very much, Doctor. I appreciate it.
Thank you for your time.
Advocacy Day may be over, but the work doesn't end here. Remember to report back to MAFP or MAOFP staff on how your meeting went. Were there any issues worth additional attention or follow-up? Write a thank you letter to your legislator. You're welcome to contact MAFP or MAOFP staff for assistance if needed. Did you offer to host your legislator or their staff during an office visit? Be sure to follow up to schedule this appointment. MAFP or MAOFP staff can help to facilitate these meetings. Finally, stay engaged. Maintain frequent contact with the staff and legislator as issues arise. Sustaining these relationships with lawmakers over time is one of the most important parts of advocacy. Thank you for joining us to help strengthen the voice of family medicine in Michigan. We hope you have a fantastic Advocacy Day experience.